Okay, I think we can start. Welcome everyone again. Welcome to the Sahlgrenska Global Health Hackathon. Today is all about matchmaking and team formation. So this live session has been organized for you guys to facilitate a little bit more finding a team or also finding new team members for your team. So this is all what it's all about today. Let me, first of all, explain the house rules in just a couple of minutes. So as you can see, the meeting has been recorded. We will upload it on YouTube and we will make it available on Event Tornado under the live sessions tab. We do have a couple of teams and people that would like to talk today. But you can raise your hand anytime when it's the moment to talk, and we will basically allow you to come on stage and talk about yourself if you're an individual looking for a team, or if you're a team leader looking for additional team members. So this is how you can do it. You can raise your hand here on Zoom. Okay, so what is the agenda of today? So after this brief welcome and house rules, we will go on Event Tornado and we'll explain to you how to find a team. How can you find a team or add new team members on Event Tornado? And then after that is going to be pitch time. So basically, we will call you on stage. You can start your video and audio, and then you can start pitching your idea, pitching yourself, and try to find a team. So let me go to Event Tornado. So here we are on Event Tornado. This is your local event, the USA event, and here we are on the main page. So I am going to register for the moment. A very important thing that you should do while you register is to add your skills. We need your skills. Also, the other teams need your skills to understand who you are. So if you can fill in this while registering, you can also edit it after. But this way, people know what your skills are and can filter by those skills. And if they want, they can invite you to join their team or maybe to form a team together from scratch. So I'm going to select 24, even if I'm 40 this year, just to feel better. I'm going to put a dummy organization name, dummy type of organization. You guys already done this if you're here. So I click on register. Congratulations, you are successfully registered. So what can I do right now if I don't have a team? I have the participants tab. So I was talking about the skills. So you can edit your skills from here anytime from the My Skills section. So in here, you can select any other skills that you want. And then here we have the team finder. So basically, what you can do here is to, first of all, filter by the hackathon. We have 3 types of hackathon in the US for this event. We have one in Boston, one in Miami, South Florida, and then you can also join virtually from wherever you are in the US. So here, imagine that I would like to find other team members. First of all, I will filter by looking for a team. And this way, I am only visualizing the people that are looking for a team. Imagine that I am a Boston participant, right? So I only want to team up with people from Boston. How can I do that? I filter by the tags and I filter Boston here. And this way, only people joining from the Boston Hackathon will appear. Imagine that I would like someone with the business analysis skills for my team or to team up. So I can filter by the skill. And then here we are left with a bunch of people that have the skill. And what can I do right now is to ask them to form a team together if we both are not in a team. Or if I have a team, this text will change into invite to join my team. So this is how you can find other participants on the tool on Event Tornado. The second way is to go to the Teams tab. So in here, you see that we have already some ideas that have joined the hackathon. So you can click on one of them. For example, let's click on this one. You can read the description. You can see who are the team members and who is the team leader. You can leave a comment if you want already here on the discussion. But if you like the idea, you can apply to join this team. So if you do that, the team leader will receive an email with your application. You can leave a message while doing this. So basically, if I click now, you see that I can basically tell the team leader, hey, I would like to join your team because of this and because of that. So the team leader will read this message and can decide whether accept you or not. So this is how the process works. We have a third way to find other participants, or maybe to find other team members for your team. So we have set up a Discord for this event. So if you join Discord, you will see that we have Find Your Team channel. And in the Find Your Team channel, you can basically write down a description of yourself and your team to find other team members. So let me show you how it worked for another event. Let me go to the Swedish one. Let's go to Find Your Team. So as you can see here, people started talking and say, hey, hello, I have this background, I have this skill, I am looking to join the challenge number 1, 2, 3, whatever challenge you would like. So in here, this is the place for you to communicate with the other people registering for the hackathon. So I highly recommend you guys go to the Find Your Team channel in the US. I also try to tag you all. In here, you can leave your message, you can have fun, you can meet new people, and this is another way to find a team, basically. So this is how you can find a team on Event Tornado. If you have any doubt, let me go back 1 second on Discord. So if you have any doubt, you can always reach out to me, writing me a direct message. So you can click on my name, as I'm doing here, to Caitlin, and you can write me a direct message here. Any doubt that you have, I'm always reachable on Discord, so you can write me whenever you want. So this is how the team formation works on Event Tornado. And now let me shut this down, and then maybe Jamie will provide some more details about the hackathon itself. So hello, Jamie.
Hello, Michaela, and hello, USA. So I'm here in Sweden this evening. So it's 10 past 10 local time here. Michaela's in, I think, is Madrid in Spain, but we're sending love and greetings across the Atlantic to everybody in the US. And thank you so much for your interest in the Sahlgrenska Global Health Hackathon. We're so excited to be bringing it to the USA. It is a series of on-site weekend innovation hackathons, although we do have a virtual setup in the US as well. There's a bunch of crazy companies and organizations in Sweden representing academia, healthcare, and industry who have had this idea to scale up a hackathon we did last year, which was based on gender health and closing the gender health gap. That was a one-off hackathon, and this year we're going bigger and we're going global. So we're actually taking on 5 global health challenges, and we're taking the hackathon to 6 countries around the world. So we've already done, as Michaela said, Sweden, and today, actually, just a few hours ago, we had the award ceremony for the Spanish hackathon, which took place in Barcelona. Some fantastic ideas and contributions, and we crowned the winner today, which was an AI solution for child oncology solution. And so they'll be representing Spain in the global final here in Gothenburg in October. And we'd love it if there are lots of good ideas coming from the US that can challenge them in the final in October. So the idea of this session, the meaning of this session, the purpose of this session is to encourage you to join teams. There are teams, as Michaela said, looking for members. that are in Event Tornado and Discord. You can find them through those platforms. And we want more people to come with more ideas. So the whole idea of this is to healthcare needs fresh new ideas to tackle some of the most urgent healthcare challenges of our time. That's why we're doing this. So there's three main prizes for this Global Health Hackathon. There are, as I mentioned, a trip to Gothenburg in October for a member of the winning team. Lots of business mentoring opportunities as well. So Sahlgrenska Science Park is a renowned health tech incubator based in Sweden. But we have an international outreach. We're working together, as I said, with some fantastic partners. We'll see them in a minute, who are also very interested in coming in contact with you and helping to mentor you and to develop your ideas into the next big thing in health innovation. And then last but not least, there is a monetary reward. So a total pot of 15,000 euro, which I think the exchange rates at the moment is approximately $15,000. So that's globally, depending on how many hackathons we actually do, we'll divide that up among the different hackathons. So a total prize pot of 15,000. So there's a monetary reward as well, but the main thing is we want more ideas to ensure that we can come up with the next big thing in health innovation. This whole hackathon, as you know, is like free of charge for you. And hopefully it'll be a fun weekend. You get to meet new people you might not have worked with before. You get to showcase your talents and you get to hopefully get some inspiration from the people around you. So welcome. Thanks so much for joining us. And I think we've got a couple more slides before we get into the nitty-gritty of trying to pair you up into teams. So this is just a reminder of the challenges that we're working with. You can see the challenge descriptions on Event Tornado, and there they are. They're I think we all recognize most of these. But health equality or access to care, fighting cancer, healthy aging or forever vital and associated chronic disease management, infection prevention and control, and smart, safe, and sustainable healthcare. And I think you'll agree they're global health challenges that we need new innovations to help address them. The next slide, please, Michaela. Thank you. Yeah, we just quickly wanted to say thank you to our amazing global partners and local organizing hosts around the world. So you can see some big names are connected to this, supporting this and helping us to promote it around the world. AstraZeneca, Microsoft, Mölnlycke, an exciting medtech company, Business Region Gothenburg, and locally Alex in Boston, Alexion Pharmaceuticals, and I also saw Caitlin on the call from the Sweden American Chambers of Commerce in New England. They've been doing a fantastic job of helping us promote the event in New England and Boston. And in Florida, we've got some very cool partners as well, led by Shell Door at the Seven Bridges Group. So we're so grateful for all these organizations, and you can see the name Sahlgrenska there comes up 3 times. So there is a science park, and there's a university hospital, and there is a Sahlgrenska Academy, which is the medical institution of Gothenburg University. They're all teaming up to bring this hackathon. So again, thanks so much for your interest. We'd really love to have you with us on April the 5th and 6th during the weekend. So we're putting on free food for those who join us in person, and we hope we'll have a fun and exciting, collaborative and successful hackathon together with you. We're looking forward to seeing you there. Michaela, back to you.
Thank you. Thank you so much, Jamie. So now it's pitch time. So as I was mentioning before, we have some people that already wrote me that they would like to pitch today. But any point, anytime, you can raise your hand again, and then we will basically allow you on stage. I don't see in the chat the first person, which is Eric Moyal. So Eric, I don't know if you are joining this meeting with a different name as a participant.
I think you just joined.
There you are. Yes, there you are. So hey Eric, how you doing?
I'm doing well. Apologies.
Just in time.
All right, so welcome on stage. The floor is yours. I mean, you just on time. I was just calling your name, so you missed all the introduction part. So yeah, basically, yeah, the floor is yours. Please introduce yourself, introduce your idea. We are here with you.
No problem. Thank you. Again, apologies. I'm glad I made it right on time, but yeah, I apologize for being so late. I'm Eric. I'm the founder of Project Insulin. We're a nonprofit making our own generic insulin that we're going to sell directly to patients at cost, regardless of insurance status, based in Boston, Massachusetts. And we are looking to build a team and specifically focused on supply chain and distribution partnerships. Those are the two problems we're trying to tackle during this hackathon. Yeah, I don't know. Anything else? Again, I know I missed all of it, but if there's anything else I was supposed to say, just let me know.
So I am sharing here in the chat the link to Eric's idea in case you would like to join him. You need to be logged into Event Tornado to see it. So you might click right now and then you won't see it. But yeah, if you log in with your email that you register on Event Tornado, then you will definitely see it. So thanks so much, Eric. Looking forward to see you at the hackathon. The second person that we have is Alka, which I see here on the chat. So Alka, welcome on stage. Yeah, how you doing? All good? I think you're on mute. Yeah.
Yes, thank you. Yes, I turned on my video, but not my audio. Yes, thank you. So I'll just say from the outset that my idea is nowhere near as well thought out as Eric's. I'll just say I have a real passion for infectious disease, so that's why challenge number 4 really appealed to me. I have an idea in the vaccine space. It's actually kind of an old idea, so I don't claim it's original, but I don't think it's been developed to the point that that there's nothing commercially in the market. But I think it could definitely use some more work. And so, you know, I sort of started a group. I mean, there was one other group addressing challenge 4, but you know, I'm not entirely sure what their focus is, but I really want to focus on something as far as therapeutics or preventatives in the antimicrobial space, either vaccines or drugs or things like that. So I was hoping to find some like-minded individuals who could sort of get together and brainstorm something. Like I said, I have a vaccine idea, but there are lots of other interesting ideas out there too. So that's kind of what I was hoping to find here.
Okay, thanks so much, Alka. So let me share my screen again for a second with a suggestion that I might have. So if I'm not wrong, this is your idea, right? So I would suggest, Alka, if you can edit the idea description and then in there basically provide a description of what your idea is, because it's crucial for the other to understand that and then apply to join your team. So this is, if you do that, it will really help you then attract new team members.
Sure. Yeah, no problem. I'll do that.
All right. Thank you so much. Let me maybe go back to the chat, because Manasi, I see that you are based in Boston too. You wrote it in the chat. I mean,
Yeah.
This is the chance to come up on stage. Maybe tell us who you are, your background, your skills.
I don't know. I'm in a coffee shop, so I don't know if my video is that great, but I'll just do it without a video.
We hope the coffee is good at least.
It's Panera bread, so yeah, it's decent.
All
So
right.
I'll stay off video, but I like Eric's idea, and I am based in Boston too. My background is in biotechnology, as in regulatory affairs and patient safety. So when he pitched, I know everyone is pitching their ideas, but I would appreciate if we could have a stronger understanding of what they're looking from the team, as in the teammates, what contribution they want from the teammates, where do they need the help, you know? So Eric's idea appealed to me, so yes.
Okay. Let me also again share my screen, sorry, while we wait for this. Just a suggestion also for Eric on how to basically tell the people what kind of skills you're looking for. So if we go back to your idea here on Event Tornado, as a team leader, you will have the chance to edit your idea and then add the missing skills here below. Now I don't see this option because I'm not the team leader of your team. But once you go on Event Tornado, you will have this option. And you can select all the skills that you're looking for. If you want to do that, people then will be able to understand what kind of profiles are you looking for. So this is just a suggestion. All right. I will stop sharing once again. So guys, anytime, if someone would like to talk, to speak, then raise your hand or maybe just start your microphone and then we will welcome you on stage. As you can see, the session is very informal and yeah, so this is how we like to do it. Any other people that would like to pitch? Let me see if we have something in the chat or raised hands.
While you're looking, Michaela, maybe I could just also make the point that it'd be fantastic if you could help us spread the word even more about the hackathon, so we can get even more participants besides the brave pioneers that you guys are signing up for this. If you have people in your networks, we're quite active posting on LinkedIn, so it'd be wonderful if you could help us spread the word. As I said, the more people, the more ideas, the better impact we can make. It'd be wonderful, to learn a little bit more about who's on the call. What do you think, Michaela?
No, I was just thinking that maybe some tips. Now that you got me thinking. Some tips are that maybe the team members, the perfect team members, you already know this person. So another idea can be to invite these people, or think about your friends and colleagues, and then you can invite them directly to your team. This could be another way. Another thing is that maybe you are joining the hackathon, you're registering as an individual, you're curious about the hackathon, but you don't have an idea. So this is not a problem. You can join, you can register your idea on Event Tornado, then you can come up with your idea in the next few days. So this is something else, or maybe during the hackathon, because we will have mentors helping you with that. So you can join the hackathon. You don't have an idea, that's okay. You join, and then you formulate your idea while we get closer, talking with the mentors and so on. So this could be another way to still joining the hackathon. If you guys would like to present yourself, just tell us who you are. Again, you can raise your hand or just start talking, and we will welcome you on stage. Let me see. Kan would like to talk. All right.
Hi, everyone. I apologize for being off video. I'm driving, but I wanted to ask, the registration deadline has expired March 13th, but from what I understand, you are open to have us reach out to further colleagues or friends or other professionals in the industry to take part in this great hackathon. is there going to be a secondary deadline to find people to potentially join the teams that are set up here? Was my question.
Yes.
Thank
So
you.
thank you, Khan. Thank you so much. Drive safe. No, I mean, the registration will close on the 31st of March. So we still have 11 days for that. And then the hackathon will start on the 5th of April. So we are right in the middle of the team formation phase, right in the middle of the registration phase. People can still register, people can still join teams. So this is the current situation.
And if I can just add, Michaela, so hi,
Wonderful,
Ken.
thank you.
Yep, thanks, Ken. I just like to add on to Michaela's point that yeah, as Michaela said, so people can still register. The deadline is the 31st of March. And Michaela does a fantastic job then of reaching out to individuals after the participation sign-up deadline and trying to get people to join teams if they're not already in a team. Michaela, that's when Michaela comes into action. And as he said, through the Event Tornado platform, which is a fantastic platform tool, and through the Discord channel, he does a wonderful job of matchmaking and trying to encourage people to get together. So the timelines, you can see them on Event Tornado as well. The registration deadline is March the 31st, and then Michaela will work his magic right up to the time of the hackathon. We really want people who have expressed an interest to be able to participate. So we'll do everything we can to help facilitate that. But you guys have to be active, thinking about what sort of ideas you have, what sort of teams you'd like to join, so that we get the best possible results.
Perfect. Jamie, great to hear your voice too. And thank you for the clarification. Of course, I'm not going to be stepping on Eric's toes, as he was very kind enough to invite me to his team. So I'm very grateful, and I look forward to partnering up with Eric and his team. So thank you all.
Wonderful. It sounds like the start of a dream team there.
But we'll see about that.
Thanks, Ken.
Thank you. Okay. All right. I don't know, Jamie, if we don't have any more people that would like to pitch, then I think we can all move to Event Tornado. Let me again, we had received a question on how to join Discord. So I think it's worth to let you know how you can join the server. So sharing my screen again. So here we are on Event Tornado. If we go to the info tab here, you have access to the hack guide. So you just need to click on the link. What is the hack guide? The hack guide contains all the instruction on how to participate in the hackathon. One of the important instructions is how to find a team. So everything that I told you today, there is a tab here in the guide, and then in here you have, based on your situation, you can understand what you can do to find team, to create your team, to add team members, and so on. So there is a dedicated page for this. But most importantly, to join Discord. So here, if we go to the Gear Up tab, in here you will see that I have provided all the instruction on how to join it. Click there, do this and do that. So once you follow this process, there is also a video on how to do that. You will be joining Discord and you can communicate more easily with us. So this is the process. I will stop sharing again. So yes, Jamie, if we don't have any more people that would like to pitch, I think we can move to Discord for the next days, where you can find us. And any time that you have any doubt, you can reach out to me or Jamie, and we will help you. Right?
Great, perfect.
All right, we have been very quick. Thank you so much, guys. A pleasure to have you here. You have a question, Carl, please.
Hey, this is
Carl.
Carl. Can you hear me?
Yes.
My question is, and I don't know if this is what other people are thinking, but I thought I read through the event tornado information, and I still don't know what exactly are the deliverables that are supposed to be delivered when we get together. I mean, idea, business plan, a working prototype. Did I miss that somewhere? Because the biggest hesitancy I have of creating a plan or joining a group is not knowing what's expected of us during those days. So without that, I don't understand. I don't have enough information to know how to move forward.
Yes. So let me share my screen again. So going back to the hack guide, which I was sharing right now. So we have the deliverables tab here. If you open that, you will see a full description of what expected during the 2-day hackathon. So there is a deliverable one, which is a page summary. It's just one page of that basically provides an explanation to your idea, what you're trying to do, to address, what is the challenge that you are addressing. With a template. So if you click here, you can download the template and then you can upload it back to Event Tornado. We have the deliverable number 2, which is a presentation. The presentation of maximum 10 slides. It must describe your solution in more details of the page summary, because you have more space, you have a presentation on a PowerPoint, so you can also, again, there is more space for you to provide information. And then we have a third one, which is a video pitch. You should record a video of a maximum 180 seconds. Of course, we're not asking you to record a 10 minutes video. So in here, basically, you have to summarize all the work that you have done during the hackathon and communicate it to the jury panel and the external world. You have all the details on how to do that, ideally how it should be, what format, and so on. And then we have a deliverable number 4, which is optional, which is anything else that you would like to provide on top of the mandatory deliverables. Have you developed an application? Have you developed, maybe you design a Figma board, or you have designed a Miro board, whatever you want to provide on top of the normal deliverables, you can do that here with this other template. So I hope this answers your question, Carl.
Yes. Yes.
Okay, fantastic. All right.
And Michaela, if I can again just jump in and say, so that information is on the front page of the US page on Event Tornado as well. On the right-hand side, you can see here on the right-hand side the timeline, and you can see deliverable 1 and deliverable 2, deliverable 3, and this is like an idea innovation hackathon. So we're not expecting to see fully blown, technically developed solutions. We're looking for this idea development and the embryo of something which could be the next big thing in health innovation. And we'll be guiding you and holding your hands all the way through this process. Yeah, so it's more the idea that we're looking for, and starting to see that there's potential for further development around this. Eric, sorry.
No worries. I'm sure you've said this already because I missed half the meeting, but when it comes to you know, winning the local, is it separated by track, or is there one winner per location regardless of track?
Yep, good question, and I can take that. And it's one winner per location. And at the moment we have 3 locations in the US. So it's Boston, which is a physical in-person hackathon, and then we've got Miami, Fort Lauderdale, which we very much hope will be a in-person hackathon. And then there's a virtual for anywhere across the US. So it's and we're dependent on having a minimum of 5 teams to make it into a competition. And so at the moment, Miami, Fort Lauderdale is, yeah, it's very exciting to see if we're going to get 5 teams in that location. Otherwise, we'll probably put that together into the virtual session. So again, please help us to get as many people involved in this. Help us spread the word. But yeah, we're looking forward to a cool competition. And I also just like to say again, you missed it, Eric, but the energy and the enthusiasm, the passion, the innovation that we've seen from the hackathons in Sweden and in Spain now, the 2 we've done so far, has been amazing. Yeah, it's hard work working with this. There's a lot of administration and getting people to do stuff on top of their day jobs. But when you see those ideas and you see like the pride and the passion and the mind-blowing innovation that people come up with, it gives me so much energy, and I just want more. Just give me more. So I'm extremely excited about the potential of collaborating with you guys and developing these ideas. And then, as I said before, we've got a fantastic group of partners who are very, very interested in these ideas and helping to develop them further. There are some big companies backing this up. So bring it on.
All right. Thank you, Eric. So yes, I don't know, Jamie. If we don't have any more,
anybody else who can tell us a little bit more about themselves and yeah, what they're good at, and usually working with Americans, you're not shy. So tell us what you're good at. Tell us what type of team you're looking for, and if you've got a little tiny thought about an idea, then share it. There's some fantastic people on this call. I'm sure they could help develop it into something bigger. Innovation iteration is very, very cool. Anyone want to put their hand up and tell us who they are and what they're good at? Michaela, what are you good at?
Well, specifically today, since it's almost 11 p.m. in Madrid, I will be good at sleeping in a few minutes. So I will be doing that fantastically. No, but I just wanted to say that we have more than 100 registrants for the hackathon. So we really hope that you can find your match for this. So yeah, looking forward for your ideas. Yes.
And before you sleep, so I'm sorry, I can see Harvey, I'm putting you on the spot now, but I see your videos on there. Would you care to share why you're interested in this hackathon and what your background is? And it's very cool with the MD on the end as well.
So the reality is I just recently retired after 40 years of practice. I was involved in clinical research a lot, and it's only been a couple months. I'm getting antsy. I miss my patients more than they miss me. But I'm a board certified urologist and urogynecologist and have a lot of various interests in those areas. I'm not really sure what I'm getting myself into here.
Neither are we.
I had to look up what a hackathon was. I'm at a point in my career that I'm looking for the next big thing, and I've got various abilities, and I'm interested to see if I can use any of those.
Fantastic. Amazing. Where are you based, Harvey?
I'm in South Florida, sort of halfway between Fort Lauderdale and Miami.
Okay, wonderful. Amazing. And do you have sort of any, I don't know, where, after all that experience and service meeting patients, so do you have sort of any, what would, if you could change something, what What would you like to change? What for the better?
So that's really why I decided to get involved here. I mean, I kind of saw the handwriting on the wall many years ago that medicine was going in the maybe the, I don't want to say the wrong direction, but we were seeing a change that was not for the better. And about 12 years ago, I thought, well, maybe we should be taking advantage of the technologies. Medicine is kind of slow to adapt, I have to say. We're still using fax machines in the United States. And there's a lot of things that we could be doing better using technology. So about 12 years ago, I think, well, why don't we do something like telehealth? And that was before COVID. And I started getting involved with it. Some personal things came up that I had to put it on a shelf. And then COVID hit, and I sort of dusted it off. But the area that I think that really we could do a lot better has to do more with men's health, because we have here locally a lot of pop-up clinics, strip mall medical clinics that treat men's health, and they don't know what they're doing. They're not doing good medicine. So that's just something I'm interested in.
Fantastic. But I think that would fit really nicely into some of the challenges we have. And I can also mention the Sahlgrenska University Hospital, which is the big hospital partner backing this hackathon up, is very big into the telehealth area and home treatments, and yeah, that's part of their ongoing transformation that they're working with. So yeah, they'd be very interested in all ideas on how to improve that. Yeah, I'm sure there's might be some people on the call.
This is Carl again. I also am in South Florida. I'm currently in South America on a business trip, but I'm from Fort Lauderdale. I wanted to just kind of throw this idea out there. I'm a cancer survivor, and the thing that I was hesitant about was there's an important technology component to it. It's just pretty straightforward and easy. There are certain cancers, and people who are involved in cancers from a doctor's point of view can speak more intelligently about it, but there are certain cancers that are very preventable. You know, the easiest way to cure some cancers is to prevent it and to diagnose it early. So my colon cancer is one of the ones that's the most preventable. And it really has to do with stigma, that men in particular don't like the concept of going into a doctor and discussing that part of their body and having it examined. And I think that there was a way, and other cancers, skin cancer, things that are a lot more preventable, there's a level of education that needs to reach out and to be destigmatized. And the technical part of it is through the internet to be able to have campaigns, global campaigns around a group of cancers that can be reduced significantly if people just deal with it early and get tested for them.
Great point, Carl. Yes. Could be potentially, I don't know, Harvey and what you were talking about, and Carl, it could potentially be a little embryo of an idea there. But so that'd be fantastic. These, like, people talking and people discussing and iterating on people's thoughts and ideas. That's where the magic really happens. Yeah, Michaela, do we have any other people wanting to?
Can I say something? This is Ken or John here. I wanted to first of all say, Carl, you're very brave for sharing your story. So thanks for that. And as a person who is employed in the medical education space, I hear you, and definitely we are seeing a lot more of that coming out with early detections, tests, and tools, etc. So there's definitely hope for that for the future. So thanks for sharing. And also going back, Harvey, congrats on the retirement. And yeah, that's all I'm gonna say. Hello from up north in Vermont.
Thanks, Ken.
If I could say, it's rather than retirement, this is just a new phase. I don't like the idea that I'm going to sit on my hands and knit or something like that.
No, so Harvey, I can say if you join the hackathon and come up with a good idea, or join a team with a good idea, and then you're going to be busy after that. So as I said, there are lots of people will be very, very happy to help develop your idea, whatever that might be. I saw Alka who raised her hand.
Yes.
I'll lower my hand here. Yeah, so I think I was a bit brief before when I was describing my idea, but if we're sort of, looking to talk a bit more, yeah, also I'll just, give a bit of background about myself and why I care so much about AMR, the number 4. So I'm a PhD scientist. I've worked in industry for a long time. Many years ago, I worked on antimicrobial development at GSK. And I would have loved to stay in that field. And I've sort of watched over the years and years that, it's a space that everybody gets out of, that industry has gotten out of. I've watched, one after another. I mean, GSK is actually one of the few big pharma left who still works on it. And, it's all kind of been left, it's mostly been left to small biotechs. I've watched them over the years, one after the other go bankrupt. It's a very difficult space to be in, and yet everybody acknowledges that it's a huge crisis on the order of climate change. And it's not just like, you get an infection, you take an antibiotic for 10 days and it's over. It's, it affects anybody who's going to have surgery, who's going to have any sort of, immunosuppressive treatment for cancer, things like that. So I think, people need to realize this is a much bigger problem than, well, I might get an infection and I might have to, we're looking for new antibiotics just for that. And it's like, well, no, I mean, it's used as a preventative for in so many other fields, surgery, cancer, things like that. So, but yeah, it's a very difficult field to be in. And I know, people are thinking about better incentives than trying to link, link everything to sales, because you can't expect, because, antibiotic stewardship, it means you're not going to depend on sales. So you shouldn't. So it's a very, very difficult field. And I was very, very glad to see it was, one of the big challenges, because it is a huge challenge. And people have been thinking about it for a long time. And I guess maybe I'll say a little bit about the idea I had. It's not, I'm not going to say it's an original idea, but it's more in the vaccine space where I worked. So I did work on antibiotics many years ago, and then the job sort of dried up after that. And I started working a bit more in the vaccine space, where there are, as far as infectious disease goes, there are more opportunities there. Although I worked for 2 companies, my last 2 companies both dropped their vaccine work. So even that, even given COVID, it's not exactly as hot a field as it really should be. But yeah, I sort of think about vaccines more. And, one of the ideas I had was to, and like I said, it's not an original idea, but I think it's an idea that could definitely use some more development, is, to put vaccines in food, probiotics, things like that. So, I'm not sure if this only works for oral vaccines or for oral pathogens. I have not researched it well enough to know that, but, I know there are some ideas out there about putting food in, vaccines into like bananas or potatoes or things like that, or into bacteria, you could eat it like yogurt kind of thing. And, I know there's a bit of work out there, but I don't think there's anything on the market, and I don't know to what extent people are really working on it. So that was my thought.
Fantastic thinking, Alka. Yep. And yeah, I can just mention that the team that won in the Gothenburg hackathon was in the infection prevention and control space. So
cool.
I think there, exactly as you said, there's a huge unmet medical need there. And yeah, hopefully there's some people on this call who might want to join you on your mission. Thanks so much.
I might again jump in that as a urologist, we would deal with UTI quite frequently. I was involved in a clinical research study for a vaccine. The data is still not been developed yet. But as far as our overuse of antibiotics, I've always used a lot more of the antiseptics, like methenamine, which is now over 100 years old. It's an old-time medicine. We kind of forgot about it. It's starting to enjoy a rebirth, but it actually works very well, especially in the preventive, and allows us to use less antibiotics, because we're not good stewards of antibiotics. We've got terrible resistance problems, and antiseptics, you don't get resistance. They don't work the same way.
Yeah, great. Thanks, Harry. Fantastic. Nice. Great. There was a couple of other things, Michaela, in the chat.
Yes. So Manaz is asking if we have the links to the pitches of the winning teams in Gothenburg, in Spain, and the Swedish hackathon. So I think, Jamie, we can share this with them maybe, or
I think to start with, so we haven't made them completely available publicly. We do on LinkedIn. We've have been talking about them, referring to them, and we've been doing some interviews with some of the participants who took place. Before we spread the videos, the deliverable 3 videos that each team has submitted, we just want to make sure we've got permission from the teams to do that, and that some of them now are going into this global final, and they own all their IP related to this. So that's another point we'd like to make. When you develop and submit your ideas and you develop it, you own your ideas. As I said, there are lots of people around who would love to support you to develop those ideas, but you own them, and that's why we're not making. We want to make sure we've spoken to them and got confirmation that they're okay for us to share these, and we're in that process at the moment. So we're hoping to share a lot more information about the submissions we have so far. They are mentioned on LinkedIn, and feel free to get in contact with these people as well. I can help to facilitate that. Yeah, so there we are. Those LinkedIn would be the first stage there. Okay, Divya, I think that was looking forward to reconnecting. Also from the vaccines immune space, early career. Cool. And I think I made the point at the start. I think it's also the hackathon is a really good opportunity for people who are looking for new opportunities to showcase their talents, to learn from people like Harvey and Carl, the different perspectives there. We've got the patient perspective, and we've got the healthcare doctor perspective. So bringing these people and perspectives together, yeah, you can come up with amazing things. I think just on this call, there's sort of I'm getting the feeling there could be some really cool ideas coming up from different angles. So that's, imagine 2 days working together. And also talking and meeting with the other participants as well. Hackathons are cool. They really are. And Michaela, he's the event hackathon guru here. So if you ever want to do any other kind of hackathon, then look up Event Tornado, and Michaela can help you out there. Can you got another thought? Food for thought for later. Is how did everyone hear about this hackathon? What made you join? Yeah, good. I think we don't need to get into that right now. Michaela needs to go to sleep.
No, I mean.
But yes, that'd be great. And we do send out a survey after the event, and I think that's actually one of the questions, Michaela, if I'm not mistaken.
Yes, we will send out a survey after the event, and we will follow up with everything. Yes. So yes, we will ask you how you learn about this hackathon, how you join, and so on, so we can improve the next ones. Absolutely.
Should we wrap it up?
Yes. Yes. Okay. So
Thanks.
yes, Jamie. Yeah, please wrap it up for me.
But thank you everybody for joining the call, again, for your interest in the Sahlgrenska Global Health Hackathon. So as part of a global movement to address global health challenges, we want more participants, more ideas, more people like you taking part in this hackathon, so that we can come up with the next big thing in health innovation. And hopefully you'll enjoy the experience. Come out with energy and some new perspectives and some new fantastic contacts to move forward. But thank you so much for your interest, and really looking forward to seeing you on April 5th, 6th. And thank you, Michaela, for everything you're doing.
Thank you, Jamie. Thanks so much. Thank you, guys. It's been a pleasure. See you at the hackathon.
Bye-bye.
Bye-bye. Bye-bye. Thank you.